Hello and welcome to this episode of Akrinos Access. I'm your host, Eric Matei, joined by a very special guest in Dr. Walt Whitley, who's joining us to have a really neat conversation around the keys to really thriving in a multidisciplinary practice setting. So many of you have come to know Dr. Whitley from his time around the industry as both a full scope therapeutic optometrist, but also a consultant and a speaker and involved in so many amazing things across the industry. So really excited to welcome him to this episode of Access. Dr. Whitley, hello.
Hey.
Thank you for joining us.
Oh, of course. Hey, I'm excited to be here, Eric, and hang out with you for the next several minutes.
Absolutely. So, look, I know we've got a number of things that we kind of really want to touch on here, and it really all revolves around understanding like what are the opportunities out there for modern ODs at any stage of their practice, and understanding the opportunity out there in working in a multidisciplinary setting. And so, as it were, why don't we maybe kick things off, Dr. Whitley? Maybe you can just share a little bit about your background and how you've kind of forged your way through your career, and I guess as a prelude to jumping into this conversation.
Okay. Hey, I'm the Director of Professional Education and Relations at Virginia Eye Consultants, and I'm also the Regional Medical Director for Eye Care Partners. And so I've been in practice for over 21 years now. And so I did my residency at ODMD practice and then stayed on for several years. And during that time, I was either playing softball 3 days a week, or I decided maybe I'll be productive. I was single. I'm like, hey, why don't I get a business degree? So I did that instead. And then, I did that. So whether I was going to stay with the practice I was at, whether I wanted to consult, start my own practice, or even personally, it gave me a lot of those tools and foundation. But either way, then I moved out to Virginia, been at a larger practice. But initially, we only had, 3 doctors, and I was a fourth. And now we have about 26 providers within the practice, and we just keep growing and growing. It's an ODMD practice. All the tertiary specialists within the practice, whether it's cornea, uveitis, retina, whatever it may be. So my job within the practice is anything we do it in ophthalmology is that optometry is well represented. So we're clinically integrated internally within our practice. So I have 7 ODs on my team and 2 residents, but then we also have a large referral network, which is another opportunity for people who are in practice to reach out, talk to centers like mine, talk to MDs in your area, to build those relationships, to find ways to work together.
That's amazing. That's amazing. So maybe now to kind of serve it up, and let's start talking about what this multidisciplinary practice looks like. Now, there are no two that are the exact same, but and presumably also with all the just changes in the industry, consolidation, especially amongst these ODMD practices. But maybe let's talk a little bit about what that modern multidisciplinary practice looks like from an ownership perspective, doctor coverage, specialties, and stuff of that sort.
Yeah, and so I've actually worked in 2 different centers like that. The one I started with in Nevada had 3 MDs and 3 ODs, a lot of cataracts, a lot of glaucoma, a lot of ocular surface disease. And so the surgeon only does what a surgeon needs to do. As the optometrist, we're the clinician. And so we're in the trenches doing the pre-op, doing the post-op, and helping manage a lot of the majority of the medical conditions that are out there. At the practice I'm at now is much larger. And so the ODs play a huge role in the medical management. Any emergencies, any referrals that come in often get started with the optometrist. And then if the patient needs specialty care, then it goes to whatever surgeon it may be, whether it's actually majority of the time it's cataracts, but it may be glaucoma, it may be some of the other procedures or surgeons as well. And so when it comes to integration, it's just making sure that we're all working together. The surgeons doing what the surgeons need to do, the optometrists are the clinicians, and that's one thing that we teach all of our young colleagues that are coming in. Is a doctor should only do what a doctor needs to do. Delegation is going to be key because as we move forward, we know we have to be more clinically efficient. Some of the latest data points by the year 2030, there's going to be about a 32% increased need of medical eye care. But at the same time, by 2030, there's going to be about a 32% increase in cataract surgeries. There's no growth in ophthalmology, And there is growth within optometry. And so we're going to have to take a larger role in to help with the medical management of our patients.
Yeah, it's really fascinating, particularly when you serve it up in the context of this growing public health need, right? And that's really what this is all about, is realizing there's this massive and growing public health need for primary, medical, and surgical eye care. And it's fascinating to see how different organizations can deliver on that. So let's dig a little bit deeper and maybe talk a little bit about how these multi-specialty ODMD practices differ, across the patient journey. You referenced a little bit about having teams and some of these operations. So maybe elaborate a little bit about a little bit on that front.
So in regards to what particularly? I missed that.
So looking at how this differs from an operational standpoint and patient journey standpoint, as opposed to the operations and the patient journey, where it's more of a fragmented patient journey for that whole scope.
Yeah, and so the patient journey is always going to start with the optometrist, whether the patient's coming from the primary eye care provider, so referral doctor, or if it's coming internally. And so the optometrists, we grow up with our patients. We know our patients best. And so that, in a surgical practice, oftentimes when they go to the surgeon, it's going to be for cataract surgery. Whereas we grow up, I tell patients, we grow up, we wrinkle, we gray, we dry up, we get cataracts. And so it's time for cataract surgery. But education is going to be the biggest part. It's educating our patient throughout the process. When they start to get lens changes in several years, Mrs. Smith, you're going to need cataract surgery. The good news is there's great technology that we have now that can address your vision needs. But the good news is right now, glasses and contacts are working great for you. But then when it's time for surgery, hey, they've already set the stage. So they're going to be ready because you've already set that the cataract journey up. And then you can help them make that once a lifetime decision. Let's say they have astigmatism. Hey, well, here's a toric. I'd recommend astigmatism management. Or how you hated these glasses? Here's an opportunity where you can reduce your dependency on glasses. And that multifocal and trifocal technology is just getting better. And then post-operatively, letting the patient know, what your role was within post-operative care. And it's always patient choice. And so when collaborative care comes to mind, it's always what's in the best interest of the patient. But if the patient doesn't know what your role is, then you may not be part of that process. And so that's just one example for cataracts. Within our practice, we have all the various specialists. Within our practice, we have the clinicians, but then we also have the operations structure as well. And so, we have a whole team we have a director of operations. She has a whole team under her that takes care of the technicians, the others that take care of the front office, medical records, billing and coding. And so we are fortunate to have all those. And, that's come with growth because we were never this big. I mean, when I started, I was the fourth doctor. and with how the whole industry is changing, and so we're part of private equity, and we were Virginia Eye, then we were Virginia Eye part of CVP, and then now we're part of Eye Care Partners. And so just seeing the growth within the industry and within our practice has been very exciting.
Yeah, and I think what's interesting also is when you look at it contextually from the standpoint of that seamless patient journey, the dynamics to practice economics as well, right? And profitability and some of that, and a lot of these systems that are to be put in place. So, something you mentioned a few times here, a few points you made here, Dr. Whitley, regarding the teams and that patient education. Why don't you speak a little bit about, and this is something that I think also applies to anyone in any practice setting, no matter how big or how small, but the role of the team and development and delegation to your team to get things done throughout that patient journey.
Yeah, we can't do anything without our team. And I was sharing with Eric earlier that I see about 50 patients a day, and there's no way I could do that without my team. And so that comes from the phone, the call center that's getting the patient in, the front desk, that first interaction, right? You never get a second chance to make a bad first impression, and that sets the stage for the whole examination for that patient, not just that first time, but going forward. And then so having our technicians, know what your protocols are and, what tests you want, your likes, your dislikes. I'm fortunate to have a scribe. And so for me, my scribe already knows exactly what I'm thinking, what my next step is going to be. And I know not everybody has a scribe, but there's, different ways to cross-train your teams. So if you have numerous technicians / scribes, then people can jump in and out to make you more efficient, so you can see more patients. And we know we have to become more efficient, because without that, I mean, the reimbursement is not going up. Everything's declining. We're decreasing reimbursement. So that's why you're seeing, patients or many practices go into looking at cash-based services, whether it's going to be dry eye, whether it's aesthetics, whether it's myopia management or scleral lenses. That's why people are looking at some of these other things. And going back to the teams, if your team doesn't know what you're talking about or not on the same page, so I do a lot of dry eye.
Sure.
I diagnose the patient. I tell them, this is your condition. This is what we're going to do about it. And this is what the next step is, and making that repetitive each time. So let's say a patient needs IPL. I'll show them their images of my biography and say, hey, Mrs. Smith, this concerns me. You've lost 50% of your glands. I'm going to refer you to my dry eye counselor, and then she's going to get you scheduled and to go over everything else with you. So that saves me time in the clinic, because my dry eye counselor already knows what I'm going to talk about. And then once I can get her in our systems, so getting those systems in place, I know that 90% of the time, those patients are going to get those MGD procedures.
Because the systems are in place, because the team has been empowered and equipped with the tools and resources to be able to deliver. Yep. And then in so doing, patient outcome and practice outcome, right? Because, and I think it's important to point out, consider the degree to which, to your point, patient engages with you, you are the decision maker. However, it is your decision to then delegate that patient for treatment. Yeah. Really fascinating stuff. So let's dig a little deeper on that front and talk about, because I think we come to find, and perhaps you can elaborate on this for us also, Dr. Whitley, seeing as you've been a part of organizations that have experienced some pretty rapid growth. That is, let's talk about how to position practices to really achieve their potential, right? And particularly in these multidisciplinary settings where there's a lot going on. Because some would say, with all that's going on, with all the head count, there's more chaos and confusion. There are more constraints. But what do you feel are really the keys to success for practices to really reach their potential as they're growing in multifacets?
Yeah, that's a great question. And, what it comes down to is communication. Just like anything we do, everyone has to communicate, because if you don't know what your partner's doing, if you don't know what your surgeons are doing, or you don't know what your other optometrists in your practice are doing, you're not going to be on the same page for anything. And so having, at the minimum, quarterly meetings, or even monthly or bi-monthly, just to make sure everybody's on the same page. If there's new technology that you're trying to implement, you have to let other people know, because if you don't let those people know, they're not, like, for me, if my surgeons don't let me know, hey, I'm doing this new glaucoma procedure, how am I going to know, even talk to a patient about that without knowing that? And then not just on that end, but on the backside. So we do this procedure. What are some of these outcomes? What do we expect afterwards? How can I help co-manage or see that patient post-op to help with the clinical efficiency as well?
So the big things there, communication, number one. Absolutely.
Yeah.
Love it.
And, so I'll add one more thing, is also, and I know you talk about this a lot, is knowing your numbers, right? And so, whether it's, frame capture rate, or, revenue per encounter, or, for me, one of the things is, where are we on the dry eye? What is everyone else doing within the practice? Because if people don't realize where they're at and what the industry average is, and, what can you do to fine tune your message, fine tune that education, not just to the patient, but your team. And then when you talk about it, price, I never apologize about price. I talk about the technology. I talk about the treatments. This is what it is. Benefits, safety. This is what you need. And if you really believe in it, you will not have you will not have to apologize for price ever.
Absolutely. And by the way, I love that topic. That's a fascinating topic in and of itself, right? Yeah, value and price and stuff. We can get really nerded out on some of that stuff, I'd imagine. Good stuff. It's really fascinating also, you mentioned that communication piece, because, Dr. Whitley, that's something that absolutely, look, that applies to practices of all shapes and sizes, right? I mean, it could be a single doctor with one staff member as a leaseholder in a mall, all the way through a juggernaut ODMD environment, it all ties back to that consistency of communication. It's something you said very early on had to do with consistency of communication and education to the patient and engaging the patient in their care, in their treatment, but also what you were just mentioning regarding communication with the team. And this is both your direct reports, right? Your staff, your technicians, but also your surgeons, your colleagues that you'll be co-managing with. Really, really, really important takeaways there. So let's talk about keys to success. I mean, look, so we're sitting here having this conversation about thriving in this mixed, this multidisciplinary OD, MD practice environment. We've touched on a few of the really key pieces regarding structure, processes, communication, all being keys to success. What are some of the hurdles? Maybe if you could share some of the hurdles out there, and then maybe some of the starting points and best practices on what perhaps doctors can bring back to their practices tomorrow to help reach that next level.
So we all have our passions, and we know what we love to do, and we know there's always going to be something we want to learn more of. I've had some providers say, "Hey, I want to learn more about dry eye, or I want to learn more about specialty contacts." And so, if you're starting within an ODMD practice, or even when you're interviewing, let people know what your passions are, so they know that there's going to be that interest. If within this practice, there's always opportunities. So when I joined Virginia Eye, we don't have an optical. We have the subspecialist. And so I'm like, how am I going to grow my practice? Seeing post-ops all day long? And so that's how my residency was a lot of ocular surface. And so I embraced dry eye. And so I said, this is how I want to build the practice. And that's how I got to in 2008 to, do all the opportunities I've been fortunate to have lately. Going out there in the community. If you're starting within an ODMD practice, and let's say, hey, you're doing myopia management, you're doing scleral lenses, first you want to tell your team, you want to tell your partners, you want to tell the admin, because you want the admin on your side. Why? Because they're the ones that's going to help get this established for you. But also, you need to grow it not just from within, you need to reach out. And so going into the communities, meeting your other providers, because a lot of us don't know what everyone else does within their practice, because some of our colleagues may have some of those passions, or maybe they're not interested in scleral lenses, but they need someone to go to. And you could be that person, and you work at this ODMD practice, and then you find a way to partner together. And so that was not even answering your question, because you asked me about hurdles.
Well, well, I said hurdle. It was actually, I guess it was a poorly phrased question. It was kind of two questions that I squished together. but no, talking about that, you were speaking to like where to start, right?
Yeah.
Best practice, key to success there. And I think you bring up a really important piece that really all revolves around being proactive and being assertive. And I think now more than ever, there's tremendous opportunity, modern ODs to be proactive, to assert what they bring to the table, because modern ophthalmologists increasingly want to hear this and want to understand this and have this be an amazing collaborative experience for patients. And obviously, when you look at how practices can scale when you have multidiscipline, well, I mean, that's some more fun geeky business talk we can get into offline.
That's right. So I will answer the hurdle question, and because I see this, I've worked with in this type of setting for many years, and you can either be a younger OD wanting to work in an MD OD practice, or you've been more established, but just having that confidence when you're in there, because oftentimes it's always been, oh, ophthalmology's here, optometry's here, when we're side by side. I mean, I have a quote I used in a slide the other day. To be on the cutting edge of optometry, it used to say you have to be on the cutting edge of ophthalmology. And it wasn't my slide, but I had a discussion with one of our colleagues. She goes, Walt, I disagree. She goes, it has nothing to do with optometry and ophthalmology. It has to do with science and technology and the patient. What does the science say? What does the technology do? Does it deliver on its results? And how does it benefit our patients in clinical practice? And I said, I totally agree. I just had the slide from a long time ago. I'm glad I modified it. And so knowing that this is a partnership, if you want to get into something, communicate with your partners, communicate with your surgeons, and, have that confidence to have that discussion.
Yeah. Really, really great insights there, Dr. Whitley. And I got to tell you also, just very inspirational, right? I mean, when we look in the context of how your career has evolved and what you've been a part of and this providing these insights, absolutely tremendous. So, man, we've unpacked a lot of really great stuff here. And I suppose to kind of wrap things up, how can folks get in touch with you? I know you're very active professionally in advocacy efforts in your state association and industry. And you're also very active in LinkedIn. How can if folks want to just kind of reach out to you, get to know you, connect, perhaps book you for a speaking opportunity, what would be the best way for them to get in touch with you?
Email me, whitley@cvphealth.com. And I'm happy to reach out to me anytime. I'm happy to communicate because, we all grow together. And
absolutely.
So I can help you. There's also ways that, we all help each other. So thank you so much for this opportunity, Eric.
Absolutely. And Dr. Whitley, again, thank you so much. And I must admit, I had your LinkedIn set up because not everyone always wants their email floating out there. So I had this set up. So again, viewers, if you wanted to connect with Dr. Whitley, you can find him on LinkedIn. And then that email address one more time, Dr. Whitley, was?
whitley@cvphealth.com. But that LinkedIn link was so much easier. Good job.
Oh, there we go. Fantastic. Well, Dr. Walt Whitley, thank you so much for joining us here on Akrinos Access for conversation around how modern ODs can thrive in a multidisciplinary OD/MD practice setting. To our viewers out there, if you're looking for more great content like this, subscribe to the Akrinos YouTube channel, follow us on the socials, check out akrinos.com for a lot of really great resources. And on behalf of all of us here at Akrinos, Dr. Whitley, thank you so much for joining us.
Thank you.
Eric Matei signing off.